How long does lithium take to work? When considering lithium as a treatment option, you might wonder how long it takes to feel its effects. Lithium is primarily used to treat bipolar disorder, but it has also been explored for managing symptoms that overlap with post-traumatic stress disorder, or PTSD. Understanding the timeline for lithium to work is crucial for anyone considering this medication. On average, lithium can start to show significant effects within 1 to 3 weeks after beginning treatment. However, this timeline can vary widely among individuals. Some people may notice benefits within just a couple of weeks, while others might take several months to experience optimal results. This variability can depend on factors like individual metabolism, the specific symptoms being treated, and any other medications being taken. While lithium is not specifically approved for treating PTSD, there is some interest in its potential effects on memory consolidation. This could theoretically help mitigate the development of PTSD symptoms. However, it's important to note that this use is speculative and not part of standard treatment protocols for PTSD. For individuals dealing with PTSD, the primary treatments usually include selective serotonin reuptake inhibitors, or SSRIs, and therapies like cognitive behavioral therapy. Lithium might be considered in cases where a person has both PTSD and bipolar disorder, but its effectiveness in these scenarios can be lower compared to when it is used solely for bipolar disorder. It's also essential to keep in mind that lithium requires careful monitoring due to its potential for toxicity. This means that working closely with a healthcare provider is crucial when using lithium, especially if you are managing PTSD. If you have both PTSD and bipolar disorder, discussing treatment options with a healthcare professional is vital to ensure the best approach for your specific situation. While exploring alternative treatments, remember that established treatments like SSRIs and psychotherapy remains the cornerstone for managing PTSD symptoms. In summary, while lithium can start working within a few weeks for some conditions, its use in the context of PTSD is not standard and should be approached with caution under medical supervision. Always consult with a healthcare professional to determine the best treatment plan for your needs.